Hello guys, I'm Dr. Isa Khan and you are watching MedicoTube. Today is our second lesson in the second video for the pharmacokinetics, and we will discuss the absorption of the drug today. So let's start with the definition of the absorption. The absorption is the transfer of the drug from the site of administration to the bloodstream. Whether you apply the drug topically on the skin, whether you administer the drug IV, whether you administer the drug IM or orally, wherever you applied the drug, from that area it moves to the systemic circulation or to the bloodstream. Between these two areas, the process is called the absorption of the drug. Now let's discuss the mechanism of the drug absorption. There are different mechanisms through which the drug is absorbed. So absorption of the drug can happen in the 4 different ways depending upon the chemical properties of the drug. The first one is the passive diffusion, and the second one is the facilitated diffusion, and the third one is the active transport. The fourth one is the endocytosis. So we will first go with the passive diffusion. Most of the drug are absorbed through this process through the passive diffusion. The passive diffusion drugs simply moves from the area of the higher concentration to the lower concentration. Means if you administer 100 mg of the drug and it reaches to the systemic circulation 70% or the 60%, means if you administer the 100 mg drug, the 70% are present in the bloodstream. So we divide the body into different compartments, that is the liquid compartment, the tissue compartment. So the drug is present in the liquid compartment, that is bloodstream, and how much present? 70% present, means 70 mg is present. So it will move from the blood to the tissue compartment till it become the concentration gradient. The concentration gradient means that the drug present at the both side equal. Means if the drug is 50% in the blood, it must be 50% in the tissue compartment, then it becomes the concentration gradient, and it cannot moves from the higher concentration to the lower because both sided are the equal. But there is the elimination of the drug. So the drug exit from the body, from the tissue compartment, so the blood stream again has the more concentration, and again move from the higher to the lower. If we see in the diagram, let me search the pen. This one, the pen, wait, yeah, this one. So this is the plasma membrane of the cell, and there is different ways for the different drugs. The water soluble drugs penetrate the cell through aqueous channel or pores, whereas the lipid soluble radially moves across the biological membranes due to their solubility in the membrane lipid bilayer. So these are the water soluble drugs channels. The water soluble drugs directly move through this channel and they get into the cell, while the lipid soluble drug, they can easily move through the cell. There is no restriction for them. So this was simply about the passive diffusion. Now let's go for the second one, that is the facilitated diffusion. The mechanism of facilitated diffusion is same like the passive diffusion, but the only difference is here is the need of carriers. On the passive diffusion, we do not need any carrier, we do not need any energy. But for the facilitated diffusion, some drug has the extra molecular weight, they has the large sizes molecules, so they cannot cross the cell membrane, they cannot go directly to the cell membrane. So they need some carriers for them that can take them and get into the cell. There are some different proteins that can get the drug, and they cross the cell membrane and exit the drug into the cell. So this is also simple, nothing difficult here. Here the drug also move from the higher concentration to the lower, same as the passive diffusion. The only difference here is in this system the drug need carriers, because the drug has the large molecular size, so it need carriers to pass the cell membrane. Now let's go for the third one, that is the active transport. The active transport, the mode of in this one, the mode of the entry also involves the specific carrier proteins that span the membrane. Approved drugs closely resembles the structure of the naturally occurring metabolites, are actively transported across the cell membrane using specific carrier proteins. Energy dependent active transport. So here is the difference, that here we need the energy, we need carriers, then the drug can cross the cell membrane. So let's see the mechanism. Let me take the pen. Yeah, I have the pen. Okay, so these are the drugs. If you see, these are the drug molecule outside the cell membrane, and we need carrier protein. Look, this is the carrier protein. We must need the carrier protein. So drug go through this carrier protein to cross the cell membrane. Okay, these are the drug transporter or carrier protein. The drug binds with the drug transporter, and then the hydrolysis occur, and the ATP convert into the ADP. So here we need energy. This is the energy dependent. The ATP is converted into the ADP via the hydrolysis, and the carrier protein take the drug and cross the cell membrane through here, and drug reach to the inside the cell. So this was simply about the active transport. Now we will see the next one, that is the endocytosis. This type of absorption is used to transport the drug of the exceptionally large size across the cell membrane. Endocytosis involves the engulfment of the drug by the cell membrane and transport into the cell by pinching of the drug-filled vesicles. Let's see the mechanism here. If you guys see, these are the drug molecules throughout the extracellular fluid, and these are the cell membrane. So what happened, the drug come and the cell membrane engulf the drug, they eat the drug, and they make the vesicle, bind vesicle, and drug get into the cell via this vesicle, and here and then the drug in this vesicle then burst and the drug release. So this mechanism of the drug for the extra large molecular size drugs. Thank you so much. This was all about the absorption of the drug. Remember to subscribe the channel and press the bell icon so you can get the new videos. Thank you once again.